Thanks, Susan.
Being here tonight reminds me of why I chose this program and listening to Teresa again. It's so exciting, but it's hard to imagine. It was only 5 months ago that I was here attending my first informational meeting for the Susan Samueli Integrative Health and Wellness Coaching Program. And here I am. Now we're halfway through the program. It's really amazing. So it all happened for me quite serendipitously last spring, just April. I'm a semi-retired professor of education. And at the time, I was feeling ready to pursue something new. And in my case, this meant a longstanding interest in integrative medicine. So I started researching programs in health and wellness coaching, and I was inundated. It's unbelievable how many options there are out there with a full range of a big spectrum. And so I narrowed them down, all the programs down to academic programs affiliated with a university. And I saw that UC Irvine was holding its information meeting. I believe it was that same week. I mean, it was really kind of meant to be for me. And when I attended like you are now, I was really impressed with the thoughtfulness, the care, and the solid knowledge, as well as just the sense of respect for people that just has gone into this presentation as well as the whole program. So I applied, and here I am. It's amazing to me. And hearing you tonight, Teresa, just validates this decision. So as a professor of nearly 30 years, working primarily with master's and doctoral students on their research projects, I see many parallels with dissertation advising and coaching, and actually faculty advising in general. I really appreciate the skills I'm learning on how to authentically and actively listen to clients, and to hold back on giving my own opinions. So interacting without judgment. I particularly respect the focus on giving autonomy to clients as they pursue change to live their best lives. And Teresa spoke to that, just that real strong sense of respect for self-efficacy. I also value the concentration on mental health, since I have observed so many challenges in this area among my students that became so acutely heightened during the pandemic. So as a result, I have learned a great deal from the presentations we've had in class from university faculty and psychiatry on such common issues today like depression and anxiety. And for those of us like me with little background in healthcare fields, the curriculum is really designed to fill us in. For example, just today, I watched a really helpful, very extensive presentation on infectious diseases by someone at Duke University who's on the faculty of medicine, and specializes as an internist and psychiatrist. I learned so much from that. So right now, I can't wait to start being a coach, even though I'm, quote, retired, although I prefer the term rewired. I recently committed to chairing a doctoral students dissertation committee because of this program. And I already have been applying what I'm learning in focusing on his autonomy. So I'm approaching this work really differently than I did before, and it's working really well. I have fantasized starting my own practice as a dissertation coach with a focus on wellness. However, I would prefer working in a more public setting. And I just discovered an organization in Oakland, near where I live, that does health and wellness coaching almost exclusively with low-income Black, Indigenous people of color, largely through group coaching. And I look forward to finding out more about their work. Actually, this weekend, they're doing a fundraising walk, and I'm going to go and meet them. So in conclusion, I'm fired up and ready to go, which is a wonderful way to feel at my age. So welcome, everyone.